Hello, how are you today? You know what? This is June and it is Men's Health Month. So, we are coming here in order to give you some information in order to help men's health. So, if you are a woman listening to this would be some information that you can take and use for your male partner. Or if you're a man listening to this is something that you can use in order to put into place for yourself. So, let me start by introducing myself. My name is Trinette Stanford, and I'm a nurse practitioner and a diabetes health and education specialist. Have a company called Totally About Diabetes, which is a coaching, education, and support program. So, with me being a nurse practitioner, there are many issues that I cover, and it's not just diabetes. So that's why I look at the holistic approach of taking care of all kinds of things. And in fact, before I retired from clinical practice, my active practice was working in a VA facility. I worked with veterans where 90% of my patients were men. So yes, I understand some of the dilemmas that men face. So today I have Shani Hart with me, and I'm going to turn it over to her and let her introduce herself.
Oh, thank you. Thanks for having me. Like I said, I'm Shani Hart. My husband and I own two adult stores in the DMV area called Heart's Desires. We like to call them erotic boutiques and be fancy. Um, and I also founded a sensual CBD company. So I could talk about a few things about how the things that I sell and talk about and educate men might be able to help somebody.
Okay, very good. Now, some of the background health history as far as men are concerned, what I have noted is men start experiencing erectile dysfunction. When I talk about ED, I'm talking about erectile dysfunction. They start experiencing erectile dysfunction around the ages, it can start as early as the age of 35 up to 50. And it can be numerous causes for it, but two of the main reasons for it is high blood pressure and diabetes. Now, historically, men don't like to go to the doctor that much. They have a tendency to say, "Okay, nothing's the matter." But when it comes to ED, sometimes that will drive them to the doctor. But high blood pressure, well, what happens there, the blood flow is decreased to essential areas where it is decreased in the genital area, so you have erectile dysfunction from there. And then the other cause is diabetes. And diabetes is prevalent, especially in the African American community. And over 34 million people in the United States have diabetes. Now, the thing about diabetes, uncontrolled blood sugars can cause nerve damage. And you may complain about tingling in your feet or your legs. Well, guess what? You have nerves that go to the pelvic region, that go to the genital area. And when the nerves are impaired, that can lead to erectile dysfunction. So, the number one tip that I have from my point of view, what you can do is make sure that you control your blood pressure and make sure that you control your blood sugars. Those are the two things that are essential in helping to improve your health. But ED issues, sometimes you need a little bit more help in that area because sometimes it may reverse itself, but sometimes it won't. So that's where Shiny comes in order to offer you some alternatives in order to assist in that area. So I'm going to let her talk about her products and services that she has.
Yes, it's one of our. We have, like I said, we have two stores. One store, our biggest store, our first store, is in a primarily African American community, and we see so many men come in and trying to find things that they can use to help them in the bedroom. And sometimes they're young in their 20s. And I'm like, oh my goodness, we
Mhm.
got to take better care of ourselves. I think if more men knew that they might have issues with their penis, and later on in life, I think earlier they might take better care of themselves. Like that needs to be on posters everywhere. Take care of yourself so your penis will act right.
Mhm. Yeah.
But we like to, well, yeah, I think that would help. So when someone comes in and they talk about they're having erection issues, first we always ask, have you been to a doctor? Because sometimes having blood flow issues, if they haven't been diagnosed with diabetes or high blood pressure, something, it could show that there are other things going on in the body and they're just noticing it first in their penis. So that's first things first. We always ask, have you been to a doctor? Have you been to a urologist and have had everything checked out? And they might say, yeah, I've been. I know what my issues are. I still need something to help me. It's like, okay. Now I get down to more questions. Question number 2. Do you have trouble getting an erection or do you have trouble keeping an erection? Because those are going to be different things that I'm going to suggest. So let's start with people that have trouble getting an erection. So because you're gonna hear us say blood flow over and over again, because what happens is when the penis is flaccid, blood going into the penis, that's what makes it get erect. So when you have diabetes, like we talked about nerve pain, sometimes the veins are constricted, not enough blood is getting to the penis. Um, a lot of people take different medications for high blood pressure, which also is lowering the amount of blood flow. With some people don't want to take the medication because of that, and it's like, no, you still got to take your medicine. Let's try some other avenues without you about to die not taking the medicine. But so we want to get the blood flow going to the shaft of the penis so you can get an erection. One of the easiest things that I suggest is a pump, a penis pump. And I forgot to bring one up here. I have toys. I'm in my office and I have toys all over the place. But what the penis pump is going to do, you're going to put the penis inside the pump, and it's going to have some sort of way. Either it's going to have an
Bam.
actual manual pump. Sometimes it has a ball that you squeeze. But what it is taking the air, and the air is pulling the blood into the penis. So that is forcing the erection. So when you're using the penis pump, you want to make sure that you have a cock ring close by. You want to have a
Mm.
cock ring super close by, because if you're having blood flow issues, you get the penis hard in the pump, you take the pump off, and then if the blood goes back out of the shaft really fast, then it'll be flaccid
No.
again. So what you're going to do is as soon as you take off the penis pump, you're going to quickly put on your cock ring. And the cock ring, usually this one I like because it's silicone, so it's sturdy. They're all stretchy. So what you're gonna do is it's helpful, especially if you have a lot of hair down there, growing hair and everything like that. It's helpful to use some lube because it will snatch them hairs, and that's not gonna feel good at all. So put the lube on the cock ring, and people like to wear the cock ring in different places. It's gonna be a trial and error period figuring out where exactly you need to put it at. Some people like to put it around the base. This I had this dildo out because I was talking about pegging. So this is a very small one for pegging. But some people like putting the cock ring just towards the bottom of the shaft, and that
Mhm.
works. Some people need to stretch it and pull it around the balls and the shaft to hold even more blood in. And also, sometimes when you have the cock ring around the shaft and the balls, it makes the balls hang down a little bit more. And sometimes that also helps with stamina. So you'll figure out where exactly to put the cock ring. Some people use more than one cock ring. They might need one in the middle of the shaft and at the end of the shaft, maybe another one around the balls. So just try it out. They come in lots of different packs of threes, or you could try different materials: rubber, silicone, metal. There are adjustable ones with snaps on it, all different ones. So that's the first thing I suggest for people that have trouble getting an erection. Next thing I suggest for people that have trouble getting an erection is try using different vibrators. A lot of times, the sensation of the vibration helps stimulate everything going on down there and helps bring blood into the shaft also. So trying using something like, you even simple as a bullet. And you're if you're a man in a heterosexual relationship, maybe your partner, maybe your girl got some toys, borrow one of her toys and use it. This one I like. It's specifically designed for penises. This one is the Manta by Fun Factory. You just turn it on, and I don't know if you could tell, it's vibrating a little bit, but your penis just goes in here. You'll put some lube in here, and then you can just stroke around, concentrating. A lot of people like to concentrate on the tip. The tip of the penis has a lot of nerve endings, so sometimes that's helpful to put the vibration right there. And you can stroke the penis, and then you might see that that might be an easy way to get an erection. And also, you're still going to follow that up, just like the penis pump, follow that up with the cock ring. So those are two things that you can try if you have trouble getting an erection. If you have trouble keeping an erection, also the cock ring. So the cock ring, once you're able to get hard on your own, you're going to put the cock ring on, and the cock ring is going to keep the blood in the penis, so that while you're getting it in and getting all your strokes in, that the blood is not going to go out, and you'll need some help. Another thing that I suggest are different penis sleeves. So what they do is they'll go on top of the penis, and there's a lot of different models. But what they do is give you some support, some extra support. Either they're going to cover the whole penis. Maybe you have trouble getting an erection, and maybe you just can't get an erection at all, but you still want to be intimate with your partner. So there are different penis sleeves that will cover your whole penis. And you could buy whatever size you like, but you might want to change it up and get a bigger size or whatever. And then you can still have something nice down there and please your partner. That's helpful. Some of them are just support sleeves, where a lot of the penis is still exposed. You'll still get feeling, but it's going to be something that's going to help you. If you lose some of the erection, then the sleeve is still going to be there to give you some support, so that you'll still be able to continue stroking and continue pleasing. So those are the main things that I suggest to men when they come in and they have erectile issues, and they still want to get their penis in the game, and get and try to work on that. But I also like to tell people that um, it's good to have conversations with your partner, because it might be that sometimes uh, the pressure of everything a lot of times can affect the penis also. So say you have diabetes and you already have erectile issues. If you're going into sex worrying about, oh my goodness, am I going to be able to get hard? What's going to happen? Da, da, da. Your brain is one of your biggest sex organs. So
Mhm.
performance anxiety comes into play often. And then that just makes it worse. It's just going to make it worse, because you're the anxiety before having sex. It's going to make you have more penis issues. So having conversations with your partner about, like, letting them know that you have an issue, maybe not trying, because sometimes I think people, especially if you have a new partner, might be trying to hide it. Or maybe if this is something that just started, you've been with your partner all these years, and all of a sudden now you're having issues and you're embarrassed, you're nervous, you don't know what's going to happen. It's really good to have these honest conversations with your partner and be like, hey, I'm having some issues. I went to the doctor and get it checked out. We might have to do some things differently going forward. If I'm not going to be able to use my penis in the same way that I have done, what are some other things that I could do to please you? Most of us ain't gonna turn down oral sex. You might get proficient in that. You might work on that. So figuring out different things that you can do to still continue the intimacy and continue pleasing your partner. I understand how these erections are a big part of manhood, and a lot of men, they have their ego in their penis, and when that doesn't go well, it's you feel you feel bad. And I totally understand. I get it. But having conversations with your partner about what's going on, being honest about what's going on.
Mhm.
I think that could help more than any of the other things that I just showed. So that's something that I like to tell people too. But usually the men, when they come in the store, they don't want to hear that part. They're like, just give me something to fix it.
Yeah. Well, I have a question. Have you worked with men who have had surgery as far as like prostate removal? It's prostate, they've undergone treatment for prostate cancer and they have experienced problems. Have you found any items that have been effective or successful in that area?
Is when I went to I have a certification in sex education, and I went to school in Portland um to for my sex education training. And one of our classes, we had a whole class on men's issues, and mostly the whole class dealt with erectile dysfunction. And we actually had someone come into the class that did have prostate cancer, and they
Mhm.
had surgery, and they they just were not able to get an erection anymore. And
Mhm.
something that then his partner came also with him, a female partner, and they talked about having soft sex. So it could, because so if he couldn't get, there was no way to get an erection at all, and he didn't
Mhm.
like wearing. Only thing that something that I would be able to offer would be like a penis sleeve. Some men could wear like something, a harness, and you could put the harness on and put on an attachment so you could still have
Mhm.
sex with your partner. But everybody doesn't like those sort of things. And they started having soft sex. And so he would gather up his flaccid penis and kind of stuff it inside her vagina and still have sex. And she said that the sex was even better. And we were like, it's better. How could it be better? But thinking about the anatomy of the vagina, our G spot is about 2 to 3 inches inside a vagina. And most of the time,
Mhm.
when you're having sex with an erect penis, that's going past it, because most penises are not
Mhm.
2 to 3 inches. But when they were having soft sex, the tip of his penis was right around her G spot zone and just was massaging it and massaging it. And she said the sex was even better. And I was like, when she explained it, we were like, that makes total sense. So
Mhm. Mhm.
they just changed the way that they have sex, changed the way they thought about how sex had to be, which some people would have to do that so they could still be intimate. But if we have had people that came in that had different issues from having prostate cancer or prostate issues, and we said just one of the things that I talked about earlier. But most people I found that most of them that had prostate issues, um, they could not get an erection anymore, and they went with more of the harder penis sleeves
Mhm.
that covered the whole thing, and so they could still have sex with a partner. That's what most people get.
Okay. Okay, that's good. And same issue with testicular cancer because most men that have testicular cancer are younger. It Testicular cancer is more prominent in men in their 20s and 30s.
Wow.
Yeah. So and they either have to have the testicle removed or they have to have s- some kind of um, s- chemotherapy or something like that
Hmm.
in order take care of it. But I'm quite sure that have you come across any that had those issues?
I haven't. And there's probably some people that came into the store and maybe just didn't want to divulge the information
Mhm.
and
Mhm.
came in. But yeah, sometimes, especially if there's other people in the store,
Right.
sometimes people don't want to talk about the things. A lot of times people talk to my husband more. If he's in the store, they'll come and be like, is there a guy working today? Most of our staff are women. And because
Okay.
most of our customers are women that come in, women and couples. And I mean, we do have men, but mostly women. And so some people come in, they feel more comfortable talking to another man about it. So it might have been people that came in and just didn't feel comfortable giving us all the details and just gave us the basics.
Mhm. Okay. So, most of my audience is not in the DMV area. They are spread all over the United States. So, I need you to share your how can people get in touch with you?
Oh, the best place is on Instagram. I'm always on Instagram. So I have
Mhm.
two Instagram pages. One is at Heart's Desires. That is my husband and I's toy company, adult toy company. So you'll see us talking about relationships and toys and intimacy products and things like that. And then I have another page, Sex Stuff with Shani, and I talk more about CBD. Oh, because I forgot to talk. I do a lot of people that have erectile dysfunction and specifically performance anxiety, like taking CBD products because CBD is really good for reducing anxiety. So they'll take like some of the CBD oil or one of the gummies, at least 45 minutes before they're trying to have sex. So just calm their nerves, get out of their head, get more into their body. And also, I have people that have diabetes and take CBD on a regular basis every day because CBD does help with blood flow. It helps a lot with the nerve pain. Like I said, the tingling. Some people have their feet hurt, maybe their hands hurt. A
Mhm.
lot of
Mhm.
times the extremities hurt. So CBD helps with opening up the blood vessels, increasing blood flow, and also helping with any other pain. So people, those are the two things that a lot of clients come. So they'll come into the store, they'll get CBD products, and they'll also get a cock ring and be on their merry way.
Okay. Okay. All right. Well, I want to thank you for joining me today. And what I want to leave with our audience is there are ways in order for us to help you. But the number one thing is you have to be open and honest with yourself. Number one, you have to be honest to the point that yes, I do have a problem. And then the first thing you need to do is go to your doctor, primary care provider, be open and honest with them in order to find out what is going on. You need to correct any or start treating any underlying problems. Get that taken care of, and then come to get in touch with Shani in order to see what kind of to see what method or methods will be effective in order to help you. Okay, so with that being said, we will, in the description below, there will be links to um, the different social media pages and to website in order to get more information. So, Shani, I want to thank you for being here. This has been fantastic. I learned
Oh,
a lot.
oh,
Thank
great.
you. Yeah, I learned a lot because, like I said, when I worked in the VA facility, that's one of the issues that we had to deal with. And they did have a pump type thing. And I was getting ready to close, but there was a couple of things I need to touch on. They did have a pump that they could use along with the ring that was offered. And the other was an injection that
Mm,
they would use. But Some people had needle phobias and they did not want to do the injection. Some people had needle phobias and didn't want to do the injection, and then some people went overboard and used too much. So
Oh,
yeah. So those are some issues. And then, like Shani said, do not stop taking your medicine, because some of the side effects of the medicine can be erectile dysfunction, but you do not want to stop taking the medicine. First and foremost, talk to your doctor, let them know what is going on, because they can switch the medicines, but you do not want to stop anything that can cause complications, that can cause life changing, life altering complications. Okay. So check out our links below, check out the information, and look forward to hearing from you. If you have any comments, please um, post them below and we will get back with you. So, everybody, have a great day. And I want to thank you so much, Shani, for coming in. Have a good one.
thanks for having me.
Yeah.
Bye.